NBC News is live right now from New York City. Okay, which is great, which is amazing. So I want to go ahead and give a shout out to NBC News live from New York City. Very happy. Okay, great. Happy shout out to Mayor of New York City, Bill Blasio. Very happy to be help out New York City Mayor Bill Blasio. Very happy to be out there as well. Okay, so there's a lot of other issues to address as well with COVID recovery, um, on a United on a national view versus more of a political view. Okay, now like I was talking about last night, the medication for COVID, the hydroxychloroquine, is cheap, but at the same time, it has to be administered in in different stages. Okay, because the dosage is so high and so strong that hydroxychloroquine has to be the person. Thank you. Yes. Okay, great, great, great. Yes. Yes. We'll follow up. Mhm. Okay. All right. So pretty much hospitals have to deal with a lot of other issues, as well as government agencies, as well as hospital agencies, as well as community activists, and people on a small scale, which is pretty much the mayor, local community organizers, officials, um, doctors, nurses, even parents and school officials. They all have to look at this on a different case by case basis. Okay, so again, there's a lot of things that have to be addressed. Okay. Now, like I was talking about the medication, there's different trial medications for COVID-19 out there. Okay, there's what's being mandated by our current administration in office, the hydroxychloroquine, which is actually a malaria drug. And not only that, because when Americans they think, oh, medications are simple. Medication is not simple, especially dealing with something that is treated for extreme cases. Now, usually and I really wish that the current Trump administration would actually take this into consideration, because when you are administering this Plaquenil, it's actually called Plaquenil. It's not hydroxychloroquine, which is gen, the label for it, but it's actually called Plaquenil. That is the company name brand for it. Plaquenil is only to be administered at the last desperate stages of respiratory distress, organ failure for people that have COVID-19. Okay, so it's only supposed to be administered on the last ending final stages. Okay, so somebody's on a respirator, somebody is going through organ failure, heart disease, and with other complications. These last stronger complications due to COVID-19, then that's when they would administer the Plaquenil. Plaquenil, you don't use it at the first onset of a positive diagnosis of COVID-19. It doesn't work like that. Plaquenil is only to be administered at the very desperate stages when somebody is going through complete organ failure. Then that's when we would administer the Plaquenil. Okay, I really wish that the current administration would actually let the American public know that when people are in the very tip top um, worst stages of COVID-19. They're in the hospital. They're on doctor's care. They're under respiratory distress. They're being monitored. They're on a respirator. Do you know what I mean? As well as they're being monitored, as well as they're going through organ failure. They're comatose in a comatose situation. That's when you would administer the Plaquenil medication, or Plaquenil and the hydroxychloroquine is only to be used under, okay, the clinical settings. Is not to be used on an own home basis as a medication that you pick up at the pharmacy counter. Is hydroxychloroquine is not to be used as a pharmacy, like I'm going to go pick it up at the pharmacy, everything will be okay. That is not how it works. It's supposed to be used on very severe complications of COVID-19, and it's also supposed to be used and supervised under a doctor's care. You are under 24-hour doctor supervision. I'm live on Facebook, I'm live on Twitter, and I'm live on YouTube. Okay. So Plaquenil hydroxychloroquine is only to be used under literally 24 hours supervised doctor's care because it is in its worst stages, the worst complicated stages of COVID-19. That person is going through organ failure. That person is comatose. That person is under a respirator. Therefore, you need medications like Plaquenil to be administered to the patient. And when somebody is going through malaria, okay, then that means that that person actually has a parasite in their body systems. And usually when people are in third world countries and they are diagnosed with Ebola or malaria, they literally have to be on an IV drip, okay? And they have to literally flush that parasite out of their system, or they actually have to go in and surgically remove that parasite from their bodies, from their intestines. They have to go in, the clinical staff, the surgical staff have to actually go in surgically and actually surgically remove that tapeworm, or surgically remove that parasite from the person's system, in order to get that parasite, to stop that parasite from growing in somebody's body. That's what malaria is. Malaria is a parasite. You're giving people medication for a parasite when it's just a very basic respiratory virus. Okay, so really it has to be understood on both basic terms. Okay. Now you can put people's focus in different directions. Okay, this person's supposed to focus is supposed to be in this person's focus. Completely understand that, but again, it has to be put on different terms. Okay. Yeah, it's talking about here the Wall Street Journal. Coronavirus turmoil raises depression risk among young adults. Absolutely. Washington Post. Coronavirus cases top 5 million. CNN just 2 hours ago. Coronavirus reaches more than 97,000 children in the United States by the American Academy of Pediatrics. So understand, you have to be very cautious when you are promoting, propagandizing a end stage medication to the United States population. Okay. Please be careful about that. All right. So there are other drugs as well. Okay. There is Plaquenil, as well as right here. There's one called remdesivir. Remdesivir is also another one, but the cost for remdesivir is a $2,000 cost, while Plaquenil you can get in a pharmacy. A 200 milligram for Plaquenil is about 25, 30, maybe $50 tops with a coupon, but remdesivir, the price for that is about $2,000. And right now the Congress is trying to get financial aid funding for families to be able to deal with COVID-19 treatment. So yes, great. Yes, I am. Thank you. Yes. Okay, great. Okay. Yes. Great. Okay. So, so remdesivir is also another issue that needs to be addressed as well. Okay. So, but remdesivir is administered through an IV. There's also here, there's more antiviral drugs like um, for favipiravir, as well as MERIMEPODIB, marinepodib. Okay, and then there's one here, dexamethasone. Okay, which is anti-inflammatory and is used to treat organ failure due to complications of respiratory distress with COVID-19. Okay, so dexamethasone is another one that so anti-inflammatory um, medications, which they do administer, which I was given in the hospital. They pretty much gave me aspirin and Tylenol as an anti-inflammatory one. Okay, okay, great. Okay, so dexamethasone is great. Okay, as well as other anti-inflammatory viral medications and anti-inflammatory therapies too. Okay, great. That would be awesome. As well as for immune based therapies. Okay. So they're talking about convalescent plasma. Convalescent plasma is another issue that needs to be addressed because number one, you have to make sure that you have a healthy population that tests people, that you are getting people's plasma from. Okay. So a healthy population, that means that population that you are getting people's plasma, it has to be between the ages full adults between the ages of 18, as well as it can be over a certain age limit between um, 65 through 70. Okay, so there's other issues dealing with people's plasma as well. Okay, so there's other. I don't know if you guys like it short or long. There's other issues they have to deal with plasma as well. Okay, you have to have a healthy individual, and that individual has to have no prior existing cases, no prior existing history with a sexually transmitted disease, as well as no prior existing conditions with drugs, over the counter drug addiction or street drugs. They can't have any history, okay, which it will be shown in there as well, okay. So, what's going on with the American Academy of Pediatrics? Yeah, thank you, Mayor Mighty Wash, promoting face mask coverage. Absolutely. Okay, great. So right now, from this is from MSN News. Okay, online it says, while some U.S. leaders, including the president, have said the virus doesn't pose a large risk to children, one study suggests older children can transmit the virus just as much as adults. Okay, another study said children younger than 5 carry a higher viral load than adults, raising even more questions in the role of transmission. Okay, a higher viral load. So pretty much younger children at a higher risk of getting COVID-19 than teenagers. Right here. This is from CNN, and then it was right here. It says children younger than 5 between 10 and have between 10 and 100 times more genetic material than from the novel coronavirus than adults. Battletown Council. Good morning, Battletown Council in Sussex, England. Good morning, family. Good morning, Battletown. So it's saying that children younger than 5 have between 10 and 100 times more genetic material from the novel coronavirus in their noses compared to older adults and children. So actually, children contain the virus more. Okay. It doesn't. The study doesn't talk about transmissibility. It raises questions just at school how easily the virus is able to be spread through elementary schools, through school children. Good morning, Congresswoman Ayanna Presley and her staff here in Boston. Good morning, Congresswoman Presley. So it's saying right here, this is from the CNN staff updated last month, July 30th. It's saying that we have just noticed that some of the children that we were testing for SARS-CoV-2, COVID-19, COVID-2 virus, the version that were tested, the youngest ones seem to have a higher amount of the viral DNA, the nucleic acid, a high viral load in their nose compared to some of our older children and adults, by a lead author, Dr. Taylor Hill Sargent, a pediatric infectious diseases specialist at Lurie's Children in Chicago, which is great hospital. And so when they ran the numbers about under control situations, they found out that it's actually a statistically significant higher amount of the genes that are encoded by the SARS-CoV-2 virus by the World Health Organization, which usually correlates to move to more of the virus in younger children. And the nose of children is found more in the nose of children less than 5 years old compared to older children and adults. So more, what they're trying to say is that, who wrote this article? Andrea King. Okay, so the journalist, this journalist, pretty much what she's trying to say is that the virus is able to stay doormat. Okay, is not really the virus is not really staying in little kids' noses. Is what Andrea, the journalist from CNN, was really trying to say. The virus is actually able to stay more dormant in kids without it showing any types of symptoms. Now, that's different between somebody being asymptomatic versus a virus being dormant in people. Okay, there's a difference. Really means is when somebody is asymptomatic, they are tested positive for the virus, but at the same time, though, they do not show any symptoms that the normal population shows. They don't have a high fever, they don't have any coughing, they don't have any respiratory failure, but just like walking pneumonia, you still have pneumonia, but it's just walking pneumonia. Okay, but what this article is trying to say here is that the virus is dormant. That means you really can't tell if a child has positive or negative confirmed cases in COVID-19. Okay, you really don't know if the child is testing positive or if the child is testing negative for COVID-19 okay, because it has not been expressed fully. It has not reached the stages where it can be confirmed positive or negative. So it's not really in kids, it's not really, oh my God, we need to take and we need to blow out kids' noses every single day. That's not what it's about. That's not what it's about. It's not, oh my God, we need to blow out kids' noses. We need to blow their noses every single day. That's not what this is confirming. What it is confirming is that the virus is able to be, good morning, AP, the virus is actually able to be in kids' nose as well as their cavities, their throat cavities, and is actually able to stay in there without any kind of testing revealing if they have COVID-19 or not. So it's actually able to be in their body systems and body cavities, and there's nothing that doctors can do about it, literally. Okay, so that's another thing with children. Okay, you have to be very cautious about. You have to be as simple as possible when it comes to children, as well as the medications have to be as simple as possible when you're dealing with kids as well as children under 5 years old. Okay, so it's more than it's just is lying. No, it's actually the virus is dormant. Okay, that is also another issue that needs to be addressed. Okay, I have an interview today at 11 o'clock as well as I have to talk to one of these other agencies about what's going on, okay, about this other position, okay. So here it is, okay. So children actually have a high viral load in their nose because the virus is more dormant. So it's pretty much actually there's more virus is being transmitted in kids' noses as well as in their going into their throat cavity and eventually into their lungs and the rest of their system, okay. Now, here, lead author Dr. Taylor Hale Sargent, a pediatric infectious diseases specialist at Lowry, said, and so when we actually ran the numbers, control for a few things, we found out that there was actually a statistically significant higher amount of the genes that are encoded by SARS, which usually correlates to more virus. Again, more virus in kids, which, okay, but it's still more dormant virus, okay, in the nose of children, in the nose and throat cavities of children less than 5 years old. Okay, the team analyzed 145 swab samples collected from patients with mild to moderate COVID-19 within a week of symptom onset. 46 of them were children under 5, 51 were from 5 to 17 years old, and 48 were from adults 18 to 65 years old. That's horrible. That's a horrible study. The samples were collected between the end of March and the end of April from various inpatient under doctor's supervision, outpatient still under doctor's supervision, as well as emergency department and drive-through testing sites. Okay, from a pediatric facility in Chicago. They found out that those under 5 years old had a statistically significant greater amount of the virus particles, okay, in their body cavities, correlating to a 10 to good morning, Zerlina Maxwell, good morning. Again, correlating to a, okay, here we go, a 10 to 100-fold greater amount of the virus in their upper respiratory tract. Okay, the researchers wrote in their paper. Hale Sargent says more studies need to look at the transmissibility of SARS-CoV-2 vaccine in children, of the virus in children. So this transmission doesn't seem to be particularly coming from children. I don't understand that. But her team noted in the paper that because of the stay-at-home measures implemented mid-March, many young children had fewer opportunities. That doesn't make sense to transmit it. Okay, here we go. Okay. So one of the doctors here from the University of Washington, Dr. Wagner, said that the findings are consistent with other published studies looking at viral loads across a spectrum of respiratory viruses in pediatric populations. It's not surprising to find higher viral loads in children. I think the question of what that exactly means for transmission is still not clear. Okay. So you have to be careful when you are allowing kids to go back to school, okay, because if the kid catches it at school, then they're going to take it back home, and the parents are going to get it. When the parents get it at home, then they're going to take it back to the workplace. And when the workplace gets it, then it's going to transmit it to everybody, which it happens every single year when the flu season comes around. Most of the time, when this flu season comes around, most of the adults usually get the flu bug from their kids at home. And where do the kids get the flu bug? The kids get the flu bug from their schoolmates. And that's what happens. The whole cycle starts all over and all over again. That's what school health officials and government officials have to be extremely cautious about because the cycle is going to continue to go over and over and like in a circle. Okay, so the cycle is actually going to be going back in a circle over and over again, which usually happens when the flu season, the flu virus, the flu bug happens every single year between October and March. The kids start getting coughs. Okay, the little elementary kids start getting coughs, they start sneezing, they start getting fevers, and then their parents have to pull them out a week from school because guess what? My kid got the flu bug at school. What happens when a parent has to take care of their kid? Okay, there you go. So it's like the whole cycle starts all over again. That's the issue. Okay, they're talking about kids having they're they have the transmission more exposure to it than their parents do. Okay, which is normal, but we have to differentiate between, okay, between what is a normal flu virus, a normal flu bug, versus what is COVID-19 on a more serious organ failure, serious respiratory illness, respiratory disease, organ failure, SARS disease. Okay, we really have to figure out. Good morning, Charleston. We really have to figure out what is the difference. And yes, the normal flu season is going to come about. Yes, the normal flu season is going to come about. Okay, it's going to come about in September, because right now it's already August. Right now, it's going to come about in September. It's going to come about in October. Okay, the kids are going to start getting the little sniffles. Okay, they're going to start getting little sniffles. And then what you're really going to do, you're going to have to monitor their temperature. That is what parents are pretty much going to have to do. They're going to have to literally monitor the good morning, good afternoon. It's lunchtime. Good afternoon, Mayor Marty Watts. That is literally what parents are going to have to do. They're going to have to monitor their kids' temperature every single day to make sure that it doesn't, and they're going to have to check them visually, check their temperatures every single day and monitor their emotions just to make sure anything is not out of character with my child. So yeah, it is okay for your kid to go back to school. Absolutely. But you still have to check them as a parent. Make sure, okay, is my kid okay? Honey, do you want to go to school today? Do you feel good? Do you feel okay? Yeah, mom, dad, I feel okay to go to school. Great. Then the day after that, hey honey, how do you feel? How was school today? Good. Do you have any coughs? Do you have any sniffles? No. Do you feel okay to go to school today? Yeah, mom. Yeah, dad. I feel okay to go to school today. Great. You still have to check their temperature every single day to make sure that a couple days later you have to ask them the same thing over and over again, as well as be sure to check their body. You check their oil, you check their ear temperature, as well as check their body temperature. Actually put your hand on their skin. Are they sweating? Do they feel warm? You go a couple days later, then you notice your child is sweating. Honey, why are you sweating? Are you feeling okay? Yeah, mom, I feel okay. I'm just a little tired. And when kids actually start to develop more serious side effects, then that's when you have to take them to the emergency room and get them tested for COVID-19. So it goes from a normal seasonal flu bug to something a little bit, it could turn into serious disaster or organ failure. So it can develop into their sweating. That normal temperature turns from 98.6, then it goes to 101, then it actually can go up a little bit higher to 103, and then it can start going higher and higher and higher. Well, yes, that child will drop on you. They will drop unconscious, which is what is happening with COVID-19. People are dropping unconscious. They are dropping unconscious and they're being put on respirators to control the oxygen flow, not for that person's brain energy, but for that person's organs to control the oxygen flow in their brain as well as in their organs. Okay, so pretty much what I'm trying to say is that they have to keep that oxygen flow on a constant, keep that person alive. You don't want to keep that person brain dead, which means they're losing oxygen flow to both their organs and their, okay, the upper and the lower. Okay, so again, you have to monitor your child's temperature every single day. every single day. Don't expect your school nurse to monitor your child's temperature. No. And especially if you have kids, more than one or two kids, you're literally going to have to check your kid's temperature. You have a 5-year-old kid, check his temperature first. You have a 6-month old infant, check that 6-month old infant's temperature first. Okay. So you have a 6-month old, a baby, an infant, check their temperature primarily first. Then it goes to that 5-year-old. Then it goes into that middle school kid, that sixth, seventh grader, that 12-year-old. And then you're going to the teenagers, high school kids. You have to do it on different stages. Who's more important? The baby. The babies are always more important. Check the babies first. After you check the baby's temperatures, make sure they're not sweating. Make sure they are able to their behavior is normal. Are they crying today? Are they quiet today? Is my baby a little bit quiet today? Why is my child a little bit quiet? Why is my infant quiet? Is my infant not there? Are they hungry? Okay. Honey, are you hungry? No, mom, I feel fine. I'm not hungry. Okay. Well, do you want to eat something later on? Okay, mom. And then a couple hours later, during lunchtime, you ask them again, are they hungry? No, mom, I'm not hungry. Then that's when you have to check their temperature. And if their temperature is rising, then you have to take them to the doctor. It's just as simple. You have to monitor the children's the symptoms because it happens every single year with the flu season. It happens every single year. But when COVID-19 kicks in, that's when we have to determine where it is on a more serious ventilator and organ failure issue because this is a super bug. Not just a normal flu bug. This is actually a super bug. It's a super bug. It's not the sign of the end times. This is actually a super bug. A super bug. Okay, so that's why we have to monitor. Okay, so I'm here on YouTube. I'm on live on. So, hi guys. Good morning. Okay, good morning. So you really have to monitor the kids' temperatures and their behaviors every day. Okay. Now here, right here, again, from the JAMA, from the Journal of the American Medical Association. This article was posted just in July. It says, so it is a known phenomenon in pediatrics that younger children can be the main drivers and spread of disease in their communities. Of course, kids are the main transmitters. But did COVID-19 come from a child in the United States? No. COVID-19 did not come from a child in the United States. COVID-19 was transmitted from travelers overseas. Okay. And that's how it was a mature virus in mature adults, and it came from people overseas to the United States. They were coughing and they were already sick. And the Department of Health and all these airport officials, uh, these major thorough officials that have major ports, okay, port authorities. We have the border officials. We have the airport officials. We have these bus, Greyhound, Amtrak. All these major officials were not able to see that people were coming into the United States borders sick. And they thought it was normal, but it really wasn't normal. So you have a couple people on your bus, you have a couple people on your plane that are coughing, and all you need is about one people on a crowded area. Do you know what I'm saying? To transmit the disease. Okay. So there's a lot to be done. Okay. So the behavior habits of young children, the lack of awareness and the lack of personal space and personal hygiene, all the fidgeting, the hands on play, the wiping of eyes and noses make it hard to control the spread. Talk about kids don't want to wear a mask. They will wear a mask, they're disciplined to. Now, at a society level, One of the doctors from the JAMA Journal of American Medical Association said it's important to implement infection control practices such as contact tracing and take steps at school such as keeping children within the same age groups. Absolutely. Absolutely. It's best to keep kids in the same age in small groups to limit the spread. Absolutely. But again, COVID-19 did not come from American children. American children were exposed to it, but it came from overseas. Absolutely. Thank you, CNN Health. Thank you to this great Andrea Kane. Her article still needs to be edited a little bit more. Okay. So this needs to be thought about. Okay. So there's a lot of other, so it's great. I'm glad that the Trump administration, as well as other government officials, are promoting school, not school, a normal school semester. Great. Thank you, Trump. Thank you to the Trump administration for promoting, for letting people know we want to have a normal school schedule. Okay, so that's great. So thank you guys. Again, we still need a lot more needs to be done. Absolutely. Right here, other experts say that while they're not surprised by the findings between kids, it's good to have a study. The data in pediatrics has not been as robust as adults with COVID-19. So it's really happy and nice to have additional virological data in pediatric patients, said Dr. Apana Wagner of Seattle Children's Hospital, another great one. Said the findings are consistent with other published studies looking at viral loads across a spectrum of respiratory viruses in pediatric populations. It's not surprising to find higher viral loads in kids, yeah, but it doesn't mean that kids got were the original transmitters. This is normal. And so that yeah, children are the breeding ground, but just because this Dr. Michael Smith from Children's Hospital in LA, he said that children are the breeding ground and they're part of the populations that spreads it to the rest of the community. No, no. Which, yes, this is a good one. Yes, and a no. Children, yes, can be the breeding ground. Absolutely. Because they're young and because they have a um a a weak immune system, a weaker immune system. So they can be the breeding ground easily. Easily. Yes, easily. Yes, easily. Children can become the breeding ground. Absolutely. Absolutely. Oh, yes, they can. Yes, they can become the breeding ground. Absolutely. Yes, kids can become the breeding ground. Absolutely. Oh, there's an explosion in Baltimore. Oh, that's really sad. Now here we go. Here we go. Now he's talking. Okay. Now this doctor's talking from Children's Hospital in Los Angeles. Now he's talking. Great. I like this. Now here he goes. He says, once you figure out how much, this is from a CNN Health article in July on July the 30th. He's one of the doctors from University of California Los Angeles Children's Hospital. This is a good one. He said, once you figure out the kind of dynamics of how much virus is out there and what age groups it tends to be greater and lesser in, then that can help us form strategies for surveillance, for testing, and for isolation. He said that the behavioral habits of very young children, for example, the lack of awareness of personal space and personal hygiene, okay, can make it hard to control. Okay, okay, I do understand that. So here again, from this is from the CNN. State officials and local officials have tied the resurgence of cases to large group gatherings and more infections among young people. But there's a difference. There's a difference. Okay, understand there's a difference. There's a difference between the normal flu season with a teenager or a young college student getting the seasonal flu versus a young child getting the seasonal flu. There is a major difference, guys. Please understand that. There's a major difference between older children as well as teenagers and college students have a more they have a more mature immune system. So college age students from 16 to 24 to 27 have a more mature immune system. So all these students, all these party goers in Los Angeles and Florida have already developed immune system. So pretty much they already have immunity against the seasonal flu as well as anything as they already have basic immunity. But when it comes to children under the age of 12, as well as for younger kids and babies under the age of 5, then that is the population that does not have a more matured immunity against a normal seasonal flu. Okay, that is a population that we need to watch, not these party goers, not these college students. Okay, we need to watch the population under the age of 5. Those not only because their bodies are weak and because there are more carriers of this viral infection. Okay, and also we don't have more. They have a very simple immune system, so we have to. Good morning. Thank you, Governor Baker, for implementing more than $1.8 billion for public safety. So we have to give them a very simple medication for children under the age of 5. Very, very simple medication, pretty much basic. 5 years old, basic. Like I said before yesterday, Benadryl, baby Tylenol. Usually, children under the age of 5, Tylenol. As simple, if not, if or breast milk. That is literally what it is. If they are under the age of 5, you have to make it as simple. Any other extremes kind of medication, it has to be supervised under a clinician's care. Basic, any kid under the age of 5, Tylenol or breast milk. Seriously, it has to be. Any other medications than that, it has to be monitored. Literally as simple as that, because their bodies are not more developed, which is normal. But when it comes to college age kids, like I said before, of course, yeah, they can take more modern medications. They could take the Claritin. They could take the Claritin. They could take the Advil. They could take the ibuprofen. They could take the Theraflu. You would not give Theraflu to a child under the age of 5. You would not give ibuprofen to a child under the age to a 6-month-old infant. Okay, you would not give more complicated medications to a young child. You will not do it because it is a more complicated illness. Because their system, they have very simple, okay, very simple systems, and they're still developing. So you have to be careful about that, especially careful about the medication and careful about the child and their behavior. Good morning, Roland Martin. Good morning. Exactly. Yeah, it's a very high count of Black and Latino kids dying from COVID-19. Absolutely. Why? Because of the food. Just because it's a bill. Because of, again, okay, because of their diet, Black and Latino kids' diet, as well as because of their health environment.
We're here to talk about baseball's new rules for 2020.
Because of their health environment as well.
First rule, no more spitting. No more loogies, snot rockets, Quincy Phi hyphens. And for now, no more fans in the stands. But you can sneak in. I got it, buddy. No, not this.
So it does need to be a little bit more addressed to that as well. Okay, there's a lot more things that need to be addressed. Okay, so like I said before, the older college students have already developed.
Baseball's back, and we still got Sam's.
The older college students have already developed immunity against it. So you can give a college student Theraflu, you can give them ibuprofen, you can give them aspirin, a 325 milligram tablet of two aspirins. You know, you can give a kid, a college kid, an antidepressant and use that SSRI as an anti-inflammatory medication against COVID-19 and organ failure. But when a child under the age of 5 has organ failure, then you have to monitor the medications. When a child under the age of 5 has organ failure or they are comatose, you literally everything that you put into their mouths, it has to be as simple as day and night, okay? And you also have to monitor what they eat. Okay, so it has to be simple medications for younger children, more complicated medications for older college educated children. Okay, it's normal. The seasonal flu happens every single year. The seasonal flu happens every single year. So we have to differentiate what is the seasonal flu versus what is this more complicated, mature superbug virus, COVID-19. Absolutely. Absolutely. So that still is not a reason to stop school for the fall semester. And yes, more children are going to test positive for COVID-19 because this regular seasonal flu has matured to a higher level than just a regular cough or a fever. Now more kids are being put and monitored in hospitals. So again, we have to also be especially cautious about that too as well. Okay. They talk about the NPR, talking about having COVID-19 that lasts for months. Yeah, you're being monitored. You are in a coma for 3 months because your body's going through organ failure due to pneumonia. Yes, if you have pneumonia for a very long amount of time, you will go through organ failure and you will be put in a coma. Pneumonia leads to people comatose all the time. People are comatose, yes, all the time, all the time, all the time, all the time. Yeah, that exactly on Reuters. Thank you, Nancy. Thank you, beautiful House Speaker Nancy Pelosi. Thank you. And yes, it is affecting the hotel and the tourism industry as well, from the San Francisco publication. Italian prime ministers receive coronavirus relief payments met for self-employed. Yes, right here in the Washington Post just an hour ago, they're talking about closing schools for cleaning. Yeah, which also is great. That is great. That is amazing to actually, that is wonderful. Great. Please continue to keep the schools sanitized and clean. Absolutely, absolutely. Please continue to keep school halls, cafeterias, school halls, lockers as clean and sterile as possible, sanitized as possible. So yes, you know what that means? That means more administrators are going to have to hire more janitors. Absolutely. To make sure that they have the correct formula in order there to kill this virus, the cleaning formula. Absolutely, absolutely. Absolutely. They need to hire more school janitors. Absolutely. Absolutely. You're going to open up schools, you need to hire the right people to make sure that this regular seasonal flu bug doesn't turn into something more serious. And people actually have to just start thinking about it like that. Instead of having the whole hysteria and fear, they actually have to think about it in different stages and different levels. Is it on a low stage where my child has a cough or a sore throat? Or is it on a higher stage? Good morning. Good morning. Or is it on a higher stage where my child is going from a normal cough or a normal sore throat to my child now has had a fever for 5 to 7 days and they all of a sudden passed out at school? Why did my child pass out with a high fever of 105? Do you guys get what I'm saying? Okay, so you really have to monitor your kids. Absolutely, absolutely. If we're going to reopen up the schools, we need to make sure that we have the school janitors and the correct Department of Health officials, and make sure we are hiring more school nurses. Absolutely, absolutely. Thank you so much for who wrote that article. Absolutely, absolutely. Absolutely. It's good. It's okay to have a little bit of anxiety and fear about, oh my God, I'm afraid this is a bioterroristic agent in the air. I completely understand that. But again, you have to take it on a different stages, different levels. Okay, it's on the news. Okay, it's in different countries. That's fine. But again, at the same time, it's in different countries. Now it's coming to America. Not only is it coming to America, but it's coming to my state, my city. Not only is it coming to my city, but it's coming to my suburb, my community. Okay, so it has to be done. You have to understand it on different levels in different stages. Okay, I mean, the hysteria, the fear is normal. It is normal to have a little bit of anxiety. It is normal to have a little bit of fear. That is normal. What is not normal is to all of a sudden start closing down schools, start closing down businesses, closing down libraries, closing down, we can't reopen back up music theaters. We can't reopen back up sport activities. We have to put everybody on social distancing. Everybody has to be 12 feet apart in the public parks. Athletes can't go. We can't have any more sports games. We can't have any more basketball games. We can't have any more hockey games. We can't have any more, baseball games. People. We can't have people in the stadiums. No, it's completely to the extreme. It's like the movement that happened. The movement that happened against the 1950s movement to stop drinking alcohol. During the Great Depression, during FDR, people were actually saying alcohol is of the devil. No, it's not. So it really took a lot of people to come out of that stage and that part of the United States U.S. history as well. Okay. And yes, it's also affecting our food supply as well. It is affecting our food supply. Absolutely. It is also affecting our food supply as well. Absolutely. It is extremely affecting our food supply. Oh, yes, it is. Because because as well as construction zones. Absolutely. Absolutely. There's a lot of other things that need to be addressed as well. Okay. There's a lot of things that need to be addressed as well on a different level. So we have to take it on a piecemeal by piecemeal on different stages, on different levels. Absolutely. 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 There's a lot more issues that need to be addressed. Absolutely. We need to work on addressing a lot more issues. There's a lot more things that need to be addressed. It is a major issue. I'm interviewing in 30 minutes. And yeah, it is a major issue that needs to be addressed. Absolutely. Because again, we have the schools reopening back up again. We have a lot more other issues are reopening back again. Okay, we want our kids back in school. We want our stadiums reopened. Okay, we want our stadiums reopened. We want our kids back in school. Okay, we want to go to a concert. I want to go to a concert. I want to see my favorite singer. I want to see my favorite. I want to go to a live venue. I want to go to the Hard Rock Cafe. I want to listen to a live music. Okay, I want to go to a live music festival. I want to go to a carnival. Okay, I want to go to a carnival. I want to go to Six Flags. I want to go to Disney World. You guys see where it's going? You see where it's going? You know what I'm saying? I want to go to a basketball game. I want to go to a football game. It's a lot. There's a lot more things as well to do about it. Absolutely. Absolutely. There's a lot more things. Is a lot more to take into consideration about this. You actually have to tell people what you want. But again, it happens. This happens every single year. It is nothing new. It happens every single year. Absolutely. This happens. It happens every single year. The flu season comes in and it happens every single year. It happens to people every single year. Great. We got that. We got across. Now the seasonal flu is about to come, okay? So we just came from COVID-19. Now we have the seasonal flu bug about to come. So what are we going to do about that? Again, you still have to monitor your kids and your children's symptoms every single day. Every single day. Monitor them. Monitor your kids, especially if they are under 2 years old, if they are a 6 month old infant. Monitor them. Monitor the kids. Monitor them. Monitor the kids. Absolutely. Absolutely. Monitor the kids. Absolutely. Monitor the kids. Monitor the kids. Monitor the kids. Absolutely. Monitor the kids. Monitor your child's symptoms every single day. Check to see them. Okay, honey, how do you feel today? I feel great. Great. Okay. Are you ready to go to school? I'm ready to go to school. Check your kids every single day because that normal, like I said before, that normal seasonal flu is about to come in, especially when school's about to start, late August, early September. You best believe that normal flu bug is going to hit your family. That normal flu bug will hit the family. That normal flu bug will hit, and then that's what we have to figure out: is this COVID-19 virus about to die off? No, it's not about to die off. Okay, so you continue. I don't know if the normal flu is really going to combine and go right straight into COVID-19, or is COVID-19going to die off and then the normal course of the normal seasonal flu will come into focus? No, you just figure out really what do you and your family have to do about this virus. Absolutely, there are a lot more other things that we need to work with. Absolutely, 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 absolutely. 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 Who taught you that? Who taught you how to learn this? Who taught you how to do this? Someone taught you how to do this. No, nobody showed me how to do this. I learned this on my own. I learned this through my own experience. Nobody taught me but me. Nobody showed it to me but me. I had to learn this on my own. Okay? I had to learn this on my own through failures time and time again. Okay? So, again, it's very, very important. And they're talking about right here that COVID-19 is transmitted in the nose more. No, it's not transmitted in the nose more. Is lying more dormant in other people's noses, but that's not the issue. That's not the focus. Okay, that's not where the focus should be, especially when you're dealing with your kids. No, that is no, absolutely not, absolutely not. Talk about, oh, now we can have people sing in open air. Wait, it's from who is this? Is this really NPR that really had this article? Are you serious? NPR, National Public PBS Radio? Oh, the lady who wrote this covers Me Too and gender issues. No, there usually has to be a solution about what is going on. There has to be a solution to figure out what is going on for me, as well as what is going on for my community. Okay, there's a lot of other things that need to be addressed. Absolutely. I did get that Twitter feedback, whoever just gave me that. So the talk about old clothes, it's not real. Oh my God, it is way extreme. It is extremely the feedback that I'm getting from the American public. Whoever is doing this is taking this the conservative. I think this is a more of on a conservative. This is way more ultra conservative. This is extremely ultra conservative. I mean, whatever kind of agenda this is an extremely pro right alt right agenda. You have to figure out what is the reason behind everything. Literally, you have to figure out the reason. If something as simple is not working, you have to figure out what is really it's not propaganda per se. It is the agenda. It is a really alt-right agenda. It is crazy. It is crazy. This alt-right agenda. It is crazy. It is really crazy. Because it goes into overboard extremes. From what is normal, from what history taught us, into what somebody is trying to persuade the government to do. It is really extreme, and you'll find out. You'll notice that something is extreme when you actually take step back and take a look at it. Say, you know what? I just came back from Dallas. Now I'm in LA. Why is the same thing happening? One city has more money. If this person is a billionaire and this person has 5 kids at home and working 2 jobs, that is something is wrong with this issue. And that billionaire cannot do anything about a national issue. You tell me that this person has $1 billion in their possession and they cannot take has any kind of influence over a government health epidemic. They don't have anything in their possession. They don't have any access to resources that can be able to help out a single mother with 5 kids. That person has $1 billion in their possession. They don't have any kind of resources, financial resources or political resources, in order to reach out to their community officials and tell their community officials either we're going to actually hire more nurses to come overseas to our city and be able to service our city families, or what we're going to do is we're actually going to be able to have families come together and have literally buy out hotels just to be able to isolate people and get them treated for COVID-19. If you are that rich, you can buy out a hotel. You don't have to shut down the hotel. You can buy out the hotel if you have that money. You don't have to shut down the tourism industry. You can buy out the industry. That's how it works, and use it for your own purposes. And it's happened time and time before. During the Civil War, what did they do? Millionaires were able to give out their homes. People of affluence were able to provide their homes as hospitals for soldiers, for Confederate as well as for Union soldiers. They either liberally did it or they were forced to do it by the government. So you either gave it to us liberally or we took it from you. Do you guys understand what I'm talking about? Okay. So again, there's as you really have to understand the agenda behind what is going on in the current administration. Because did this issue happen when the Bush administration with the Bush administration during 9/11? Did President Bush, did W shut down all American schools when 9/11 happened? Did he tell people don't go to church, don't go to school just because we had a terrorism attack in Washington D.C. and New York City? Did President Bush automatically tell all Americans to stay at home and be isolated from the rest of society because we have had a terroristic attack for the first time in American history? Did President Bush do this? No. No. Did Nixon do this during Vietnam? No. Yes, Nixon had protest. Yes, LBJ had protest. What about when Kennedy was shot? What about when Dr. King was shot? Did they close down all of every single government office and every single government building? Yes, especially when Dr. King was shot, they did because people protested about it. But at the same time, though, they did not shut down every single government facility because the people that were protesting needed more resources for the government in order to pass these legislative congressional acts. The Civil Rights Act, the Integration Act, the Schools Integration Acts. When Rodney King was assaulted in Los Angeles, California, there were rioting for almost a year all over the United States. And even Rodney King himself said, stop the madness, Black community, stop the madness, Black community. And the Black community still kept rioting. But guess what? Even when Rodney King was assaulted, guess what happened? They still did not shut down government and federal and businesses. Yes, police officers, police precincts were bombed and loitered. Yes, they looted grocery shops and stores when Rodney King was assaulted. Yes, but that did not stop the government from closing down every single business. Do you guys get where I'm coming from? Do you guys understand me? Maybe that's what it is. Instead of it being, just call it what it is. What is the agenda behind it? Is this a health issue or is this a political issue? Call it what it is. Just tell us what it is, President Trump. Tell us what your administration is. His administration being assaulted by the Black community? Is it the Black community? Is it Black Lives Matter? Or is it actually a global terrorism, bioterrorism agent? Call it what it is, President Trump. Call it what it is, because we can address the issues on different terms. If it is a bioterrorism agent, we can address that as a different ways. So what does that mean? If it is a bioterrorism agent, we can send out our military forces to those countries that came in to attack America and its allies, and we can do something about that right there. Or if it is a domestic issue, then we can solve a domestic issue on a different terms. We can call the National Guard and make sure that they stop these lawyers and stop these rioters from continuing going on and on for the past 8 years. Okay, we can deal with that. If it's a domestic issue, we can deal with it. Good morning, Lady Hadar. Good morning. If it is a domestic issue with the drugs, if it's a domestic issues like drugs, we can deal with that on another issue, on another scale too. If it's drugs, we can deal with drugs. We can close the borders. We can call the Drug Enforcement Administration. Do you guys understand what I'm saying? We can call the FBI and we can go ahead and get some people arrested and shot for coming into Black communities and spreading cocaine and crack on the streets. So if it's a domestic issue like the international drug trade, yeah, we could do that as well as for child and sex trafficking. If that is another issue, call it what it is. But don't try to put everything together and call it COVID-19 and close down every single government facility and every single government office and every single government resource for people to get the resources that they need. You're closing down the food stamp office. You're closing down the health department. You're preventing people from going into the emergency room because there's too many people in the emergency room. You're stopping people from going to stadiums and music venues, and you're stopping people from going to church because there's too many people in the church. It's too many people in the church. So call it what it is. Is it too many people for you, or is it a global health issue for us? Call it what it is. Call it what it is. Is it a health issue for you? Is it a health issue for us, or is it a terrorism issue for you? What is it? What is the agenda behind it? The agenda really does need to be addressed. Absolutely. Absolutely. We need to address this issue. Absolutely. Absolutely. We need to address this issue. What is the agenda? And if it keeps going on and on, if you've had a domestic group that is not authorized by the federal government, okay, okay, if you have a domestic terroristic group that is known for terroristic activities like Antifa, and they have not gone through the channels of being approved for their organization's activities by the government, call them what it is. If that person is not recognized by the government and has not gone by the proper channels to get government assistance, call that what it is. Are you a terrorism group? Are you a community activist group? But it can't be one and the same. It can't be one and the same. You can't be. Thank you. You can't be a community activist group at the same time doing terroristic activities. Okay, you can't be a community activist group talking about you want to improve the lives of your community. No, it doesn't work like that. It doesn't work like that. Or neither you can't be trying to get assistance for your community and call yourselves a church when the ministers and the leaders of the church are being jailed for assaulting your church members. You can't call yourself a 501c nonprofit organization as a church if it is being known and published in the media that your church members are being killed from domestic violence. Why is a church member all of a sudden I had being published in the news, a church member died of a domestic violence incident, and they went to this big $1 million mega church. Or a single woman was assaulted at a big $1 million mega church. Don't call yourselves a 501c nonprofit organization either. What no, Let us know the difference. Let us know the difference. Let us know the difference. Absolutely. What is the difference? Let us know who you really are. Or lose that 501c. Don't call somebody autistic in their behavior and their education and the way that they love arithmetic, reading, writing, and arithmetic. Don't call somebody autistic if they're a high been an honor roll student all their life. Don't call somebody autistic just because they refuse service from you and you're a leader of the community. Don't call somebody autistic. Don't call somebody autistic because they don't want to service you either. Or have somebody jailed or committed because they don't want to service you. Good morning, Mayor Mighty Wash. Happy Monday. Good morning. Yes, happy Monday to you, Mayor Mighty Wash here in Boston. We need to talk. There's a lot of other issues going on. A lot more issues going on that need to be addressed. Absolutely. Absolutely. A lot more issues need to be addressed. What kind of agenda is this? Is this agenda alt left, or is this an alt right agenda? Is this a conservative agenda, or is this a liberal agenda? And yes, you will be surprised how many liberals out there only want the money. They do not want to service the community. They want to service that money. They want to service where that money is coming from. They don't want to. They don't have anything to do with the community. They want to service that money. Okay. So again, what is going on? Okay. Yeah, a lot of things need to be done. Absolutely. So there's a lot more things that we need to address as a community. If we're going to come together for a national convention, we need to come together for national issues instead of letting it be bickering back and forth. The time is of the essence right now. We have very limited time. We need to hurry up and make a decision together as a community, as a health community, as a political community, and as a social community. We need to come together because the times are changing. The generations are changing. We need to come together and make decisions that will positively make an impact on our cities and on our families as well. Okay, there still has to be a difference. You have to notice the difference between what is normal and what is extreme. You have to figure out what is the difference. Absolutely, absolutely. You have to figure out the difference. Absolutely. What is normal? Is this a normal thing? Is this a normal course of life? Or is this more extreme? Is this more extreme? Okay, here's my interview. Good morning. Good morning. Yes. Yes. Okay, give me one moment. Give me 30 seconds. 1 second. Okay. One moment. Okay. So again, there needs to be a lot more issues that need to be addressed. But I thank you so much, guys, for your time on YouTube, Twitter, and Facebook. Please continue to keep me in your thoughts. I have an interview. I will be back with you guys in the next 30 minutes. Okay. I love you guys. Just look, hit me back. I'm gonna cut this real quick and short. Bye. Hello, good morning. How are you? Good, good. I'm just doing some updates.